on a course to reduce the deficit?
Economic growth, number one. Number one. We cannot even think of reducing this deficit with 1.2% growth. We've got to get back to 4, 5, 6% growth, and you can't cut your way to prosperity. You can't. Out of Europe, you're always talking about cutting, austerity. It's important to keep a lid on spending, and we did that in the 1990s. But we have to have pro-growth economic policies that really allow this economy to take off. And once the economy takes off, that's the way we increase revenues. Getting people back to work. Historically, the revenues, the tax revenue we get is about 19% of the overall gross domestic product in our country. And federal spending, in the last 60 years, has been about 20%. And so that 1% difference, that's pretty much the deficit, well, a 1% GDP gap. Ideally, I'd like to see us, maybe 19.5 on each side, so we have a balance. We're spending now about 24%, however, of our GDP, government spending. And tax revenue is only about 15 or 16%. That's why you have these gigantic deficits. We've got to, increase economic growth. That's number one. Keep a lid on spending. Number two, we have to be judicious in how we spend our tax dollars.
This question was not asked of Mr. Craig, but since you have said that you would repeal Obamacare, I think this one is a fair question. Do you believe health care is a human right, and you support Medicare, and ACOs, accountable care organizations, that a single payer system like Medicare could control medical costs for all? Please comment.
Food is a human right too, but that doesn't mean we buy food for everybody. We've got to make sure that we are making health care available as universally as we can. The President's health care bill, frankly, is going to leave 20 million people uninsured after 10 years. It costs us $1.7 trillion. What are we buying? We have to, absolutely be focused on ways to expand the scope of people who are covered. Go back. What would some of the points in that question, so I can make sure I'm answering it?
Well, do you support Medicare?
Absolutely. I am passionate about what Obamacare does to Medicare. The first step to saving Medicare is to repeal Obamacare. It takes $700 billion out of the program and puts in place the IPAB, Independent Payment Advisory Board. Those two together are a toxic mix. We have to jettison them and make sure that current Medicare recipients get what they were expecting. You don't pull the rug out from under people.
Well, I think the intent of this question was to contrast Medicare with the current system. That it would control costs. So
well,
the idea being, you accept Medicare for all kind of.
No, because we know that there's a $38 trillion unfunded liability right now. So while people currently on Medicare are fine, people in my generation, I'm worried. We got to save the program. You don't go and expand, government programs. You could do that, and guess what? You know what we'll have? We're going to have aspirins for everybody and special care for nobody. That's what's going to happen. Because government cannot do it efficiently. You cannot have this universal takeover of our healthcare system. And that's where we're headed, by the way. That's where we're headed. 30% of employers are considering dropping their employer-provided coverage. 30%. Why? It's simple. There's a penalty for an employer if they don't get health insurance for their employees. It's a $2,000 per employee penalty. The employer may be paying $12,000, $14,000 a year for health insurance. But they can see that if they pay the penalty, then their employees would theoretically get coverage in a state exchange, and they just have to pay. So they're going to save $10,000 to $13,000 per employee. If you have 100 employees, it's a lot of money. And that employer may think, I really want my people to have that health insurance plan because I believe in my people and it's a good benefit for them. But their competitor across the street says, you know what, we're going to put our folks into the exchange and I'm going to save a lot of money. I'm going to lower my costs. I'm going to lower my prices. You're not going to be able to compete with that. 30% of employers are considering dropping coverage. And then the president says, if you like your health care plan, you can keep it. Broken promise.
You say that the U.S. has the highest corporate tax rate. However, few large companies actually pay significant federal taxes. What does the high tax rate matter since it's easily avoided?
Well, it matters because the government is picking the winners and the losers. You know, the government is telling you, even though we have this 35% tax rate, if you do this, you'll save money. If you do that, you'll save money. These are decisions that should be made in an economic manner. What makes sense for the growth of the business, not, you know, what makes sense for government.
And your last question is, how would you reduce the total cost of healthcare?
We got to look at ways to get consumers engaged more in the process. You know, look at my example. You know, I had my annual CAT scans. I got them done over at the Hillman Cancer Center. They were paid for by my insurance. Every year I got the chest, pelvis, abdomen scan. You know, and I show up and I drink the dye, and I don't know what that cost because my insurance company paid for it. You know, I don't know. You know what AGH would have been charging. I don't know what Heritage Valley would have been charging. You know, I think we have to think of ways, and maybe do it through some kind of work with insurance companies where insurance companies would expect you to shop around for something to help save the cost. We need to think of ways to get consumers more involved in that decision. Because when the consumers are involved, you know, that's what's going to be a factor in driving down costs.
Thank you. You have 1 minute to make up.
All right. Well, as I mentioned, this is a job interview. So you have a choice to make a hiring decision in about a month. And I humbly ask for your vote. We need to take private sector initiative into the federal government. We know that it's broken. There are significant differences between my opponent and myself. You know, I talked about the 3 R's. Repeal Obamacare. He supports, you know, the government-centered model. I don't think that's the way to go. We'll reform our tax and spend policies. You know, he talks about, you know, raising taxes. Well, you know, the taxes they're talking about that the president wants to raise would raise taxes on 894,000 small businesses when the economy is slow. And that's where the job creation is coming from. We do not want to, you know, raise taxes in a slow economy.
Okay, thank you very much.
Thank you.